this webinar?
Yeah, I don't know if they do. I don't know if the live link does, but I can certainly, if you want to send it to me, I can certainly email it to all the attendees as well.
Okay. Yes, that would be great, because there are a lot of links if folks, you know, are on the internet and using the web. So,
Sure.
okay. All right, so I tried to divide this into more general resources and then also focusing specifically on Medicaid programs. So I'm hoping this makes sense, and certainly feel free to ask questions along the way. So there's a lot of general resources out in the community for individuals in general, and then I was trying to hone in on what would be the most important general resources for individuals who've experienced a brain injury or for their family, caregivers, and other support people. So I did list general resources along with the different websites and links. So if folks, when Jess makes this available to you, you can just go back into the PowerPoint and click on the link, and it should take you directly there. And I'll walk through each one of these just to give you a little bit more information. And certainly, Jess, you're on too, and this is your association. Jess is with the Brain Injury Association of Vermont, and of course you are watching this webinar because they've made it available. So first, should be the first place that folks go when they're looking for general services and supports around brain injury. The Brain Injury Association of Vermont, they have a lot of information on prevention programs. They offer educational programs like this one. They also have a concussion toolkit with return to learn and play, guidance and instructions. They do a lot of advocacy for individuals with brain injury at the State House. They go to Washington, D.C. They offer support groups for individuals and their support people, and those are listed on their website. And then they also do a lot of just general awareness and, of course, fundraising for their association. So without the BIA of Vermont, we wouldn't have any general resource for Vermonters who've experienced a brain injury. So they're our go-to place. Most people outreach to them via their helpline, which is listed at the bottom there, the 1877 number. And they're able to certainly direct individuals to make referrals, essentially, to other services and supports based on what the individual is requesting or might express as their current need. And I just wanted to share that March is Brain Injury Awareness Month. So one of the awareness things that the BIA has done is created this Go Blue for Brain Injury campaign. And they have all kinds of information on their website about that. And then the annual walk and roll is coming up in a couple of months, and so we would love to have folks participate in that. Again, it's another way to create awareness around brain injury, have individuals with brain injury participate in the walk and fundraising. It's in Montpelier. I'm not sure if we're still going to physically have the walk this year because of all of the coronavirus happenings. However, last year it was in Montpelier, and we walked from the high school to the State House and had a great picture taken at the State House. Another thing which I had asked Emma Rose a couple of questions just around the neuropsychological evaluation. For individuals who've experienced a brain injury, this can be really, really useful. Neuropsychological evaluations are administered by a licensed psychologist, and it's a kind of testing, Emma Rose referred to as sort of the standardized testing, and it sounds like they're still using those as a method to really be able to tease out where individuals are experiencing cognitive dysfunction or where they're seeing deficits or challenges, but also can then highlight where their areas of strengths are. So really having a neuropsych test done can help caregivers and other providers really focus on helping individuals relearn and strategies for relearning depending on what area of their cognitive testing is showing that they're having some challenges. And so you can kind of do, I guess, a basic Google search to find licensed psychologists in Vermont. You could reach out to UVM or Dartmouth, wherever, depending on what part of the state that you live in. There's also independent psychologists throughout the state as well. I wanted to bring up physiatrists. I'm not sure that this is a general kind of doctor that most people are aware of or exists, but they're doctors who work in physical medicine and rehabilitation. And so they usually work with a team of other specialists like occupational therapists, physical therapists, speech-language pathologists, and really help focus on the physical rehabilitation for individuals. And again, the medical conditions of the people they work with do include brain injury. And they work on rehabilitation methods that are, non-surgical. And so I put links in here to the University of Vermont, Dartmouth, and then Mount Ascutney. Those are the primary places where you're going to find these specialists, physiatrists, doctors who focus on the rehabilitation. In Vermont, we also have a couple of acute inpatient rehabilitation facilities. So after an individual has experienced their brain injury and is ready to move from their initial acute care in a hospital, they might then go to an acute inpatient rehabilitation facility. And in Vermont, we only have 2 of those, and one of them is located at it's the Fanny Allen Rehab, which is part of the University of Vermont Medical Center, and then the Mount Ascutney Hospital and Health Center. So it kind of geographically, at least for folks in the northern part of the state, would tend to go to Fanny Allen, and those in the southern part of the state would be able to access that service through Mount Ascutney. An acute inpatient rehab is pretty intense. Usually the physician from the hospital has to certify that there's a significant skilled need for somebody to go to inpatient rehab, and then they're doing intensive physical therapy, occupational therapy, speech-language pathology on a daily basis. They'll spend hours, up to 5 or 6 hours or more, depending on the individual's tolerance, doing these therapies to rehab. Another resource is the Visiting Nurses Association and also the BIAVT home health agencies. And this, I bring them up because this is the place where individuals are going to be able to access some outpatient therapies, such as physical therapy, the occupational therapy, speech language. We keep talking about these therapies, and I'll dive into a little bit about what each one of those does in the next slide. But an individual's physician can make a referral to the VNA or BIAVT. Individuals have a choice, I think, throughout the state of Vermont as to which home health agency they'd want to work with, but to be able to provide those skilled services if there's a need. And those skilled services are covered by Medicare, Medicaid, commercial insurances. So there's no, financial limitation or insurance limitation, if you will, for those services. And the folks that I work with who have a brain injury tend to, at different points in time, benefit from different skilled therapies, throughout their lifetime. So it's not like you have to only receive this once in your lifetime. If an individual is working with their physician and they're identifying that, maybe they've regressed a little bit here because they haven't had support or whatever it might be, the physician can then make a referral on their behalf for this therapy again. So diving into therapies, we've thrown out these words and terms quite a bit. So occupational therapists, they help with barriers that affect the individual's emotional, social, physical, and cognitive needs. They'll help work with individuals on being able to relearn, domestic type duties, if you will, like cooking, being able to manage the process of fixing a meal for themselves, what that looks like when they're in the kitchen. This can be done, again, in a person's home, which is ideal on sort of that outpatient basis. However, if somebody is in an inpatient facility, usually the facility will have a test kitchen or something like that, or an apartment type environment to help work with the individual to see what kind of supports they need to do their daily life skills. Physical therapists are focused on working with individuals who need some physical rehab, so figuring out which therapeutic exercises would support building their strength and their balance, or restoring mobility, things like that. Oftentimes, they will train the individual support person on how to do specific exercises with the individual, so that way, when the physical therapy ends, the visits end, then there can be somebody, either the individual themselves or if they have a support person trained to help them initiate those exercises ongoing, so that way they maintain their strength and their balance and their current mobility. MROs can probably speak better to this than I can, but speech language pathologists, as she was mentioning, they do a lot of assessments, diagnosing and help treat, speech, language, social communication, cognitive communication deficits, help individuals come up with strategies to manage those areas. They also can do swallow tests if individuals are having challenges with their ability to swallow food. I also put on here vision therapy. As MROs mentioned, individuals may experience different sensory issues after a brain injury. And so one of the things that has come up a lot for me working with individuals with brain injury is the vision and the need for vision therapy. And that's usually it's done by an ophthalmologist who's specially trained. However, only 5 to 10% of optometrists actually are trained to provide vision therapy. So I just have to say this is one area in Vermont where there's a little bit of a gap and a challenge for folks to find optometrists that do vision therapy. The other one is vestibular rehabilitation therapy, and I believe this is usually provided by physical therapists who are trained in this specifically, and this is for individuals who are experiencing vestibular disorders that cause vertigo, dizziness, in combination with a visual disturbance and or disrupting their balance. And there's specialized movements with the physical therapy that are done by manipulating the head, neck, and things like that. But it really has made a significant difference for folks that I've talked to who've actually had this specialized rehab and have improved or no longer have any dizziness or vertigo. I also wanted to bring up complementary therapies. A lot of individuals may benefit from these in conjunction with other traditional therapies, things like acupuncture, massage, equine therapy. There's Love Your Brain yoga, so a specialized kind of yoga designed to help and make accommodations for individuals with brain injury. There's all kinds of complementary therapies. So whereas other therapies, the OT, the PT, the SLP, typically are covered by insurance, Medicare, Medicaid, commercial insurances, unfortunately, most complementary therapies are not. So sometimes there could be a barrier for folks accessing the complementary therapies just because of the cost. However, a lot of individuals I've worked with have always want to make sure that we do talk about these because they found them beneficial. Adult outpatient mental health services is really important. Individuals who've experienced a brain injury may have had experienced mental health concerns prior to their injury, or sometimes as a result of the injury and the disruption in the chemicals in the brain from the injury, it may make individuals more prone to feeling depressed or having anxiety or experiencing other symptoms related to their mental health. And so individuals can access adult outpatient mental health services through their local designated agency. So I can actually click on this. Let's see if this link works. We'll test it out. And so it brings you to a map of Vermont, and then you can go on to whichever geographic area you live in and find out which designated agency you would go to access those mental health services. So, for instance, in Chittenden County, it would be the Howard Center. It's kind of the big one. In Rutland County, it's Rutland Mental Health. So that would be the first place to go to access services for outpatient services. Oops. They also have a crisis. Each designated agency also has a crisis phone number, and now in Vermont, you can also text VT to this number, 741741, if an individual is in crisis and needs immediate attention and to be evaluated. And that's usually they'll do, the designated agencies will do emergency evaluations for individuals who are at risk of, I guess, imminent risk of harm, I think is how they word it, to themselves or others. I bring up the area agencies on aging. These are, the area agencies on aging serve individuals age 60 or over, and they do have a senior helpline listed there. The agencies are located throughout Vermont and cover different regions, and they provide, home-delivered meals. They offer nutrition counseling. They can also help individuals figure out what Medicare, prescription plans to use. They can help connect people to other services and supports in the community. They support people by doing case management and helping them with care transitions, for example, from the hospital to a nursing home or from a nursing home to the community. They also provide case management services for a program called Choices for Care, which I will talk about later on. And they also have elder care clinicians who work in partnership with the area agencies on aging and the designated agencies to serve individuals in this age group in their home. So if there's a person who's 60 years of age or older and is homebound and is needing some mental health support, an elder care clinician could actually go to their home and do visits with them. Vermont Center for Independent Living serves individuals under the age of 60. And so again, this would be sort of the information, referral, and assistance place for folks in that age group. They also offer home-delivered meals, Meals on Wheels. They have peer advocates, so other people who have various kinds of disabilities to support individuals with disabilities and help them, navigate our somewhat complex system of care. And they have some other services listed here, which I don't really know a whole lot about. However, I did include their website link in one of the prior slides. I also wanted to share information about Sash, Support and Services at Home. And Sash is a program where they have a wellness nurse and a care coordinator located and work with individuals who live in certain congregate housing settings throughout Vermont. And so if you know of anybody in a congregate housing setting who might benefit from some care coordination or just a general check-in to help them monitor a health condition, they could be connected with the Sash coordinator and nurse at their site. Sash is really great about working with other community providers, again, making appropriate referrals to other services and supports that individuals might need. As I was putting the presentation together, I realized I didn't have a lot of information on children's services and supports, and that's because I work mostly in the adult world. But I did want to include a couple of things. We know brain injury impacts individuals throughout the lifespan. The Vermont Department of Health has children with special health care needs, and this is, again, it would be a great first stop for folks who have a child that has experienced a brain injury. And I'm going to click on the link so you can see it brings you to the page. And it shows you what services they offer: care coordination. There is a program called Children's Personal Care Services for children who are Medicaid eligible. I'll talk a little bit about the HighTech Nursing later on. They also have a pediatric palliative care program, child development clinic, and then nutrition services. So they offer a lot of services and supports for children. I also included the Vermont Family Network. Their mission is to empower and support all Vermont families of children with special health needs, and they offer a variety of supports, one being their helpline. They have a parent-to-parent match program, so if you have a child who has a brain injury or has a new brain injury, you could be connected to a parent who has had experience and has a child with a brain injury to have that parent support. They also have support groups, webinars, a whole bunch of things for families who have children with special needs. Another important resource for individuals with brain injury is the Vermont Assistive Technology Program. A lot of individuals that I work with have found, using iPads or having smartphones or, larger monitors for their computers, all kinds of different technology to be really useful. And so the Vermont Assistive Technology Program actually has tryout centers in a couple of different locations throughout the state, so individuals can go and try out different technology to see if it works for them. Let's see, we can click on the link here. And so this will bring you to the different regional tryout centers. I believe they let you borrow equipment and things to try at home, and then, just test it out and see if it works, and then bring it back. They also have while they don't directly sell products to people, they can help you access it, and then they also have different sources for assistance with funding for different technology. All right, so that's the overview for general programs. Are there any questions, comments, additional resources that you think other folks on this webinar would like to know about? Okay. So Vermont Medicaid programs, there are several, And I'll touch on each one briefly just so you have a general overview and would know how to apply for them. So first, this is a long-term care Medicaid application. We have one application now for folks to use to apply for the Choices for Care program, Developmental Disability Services, Home and Community-Based Services program, and the Traumatic Brain Injury program, and Enhanced Family Treatment. So for any of these programs, if you know somebody or would want to apply, this is the application that you would use. And you can get that from the Department of Disabilities Aging and Independent Living website, and I believe also the Department of Vermont Health Access, the DVHA website. So the brain injury program, while on the application it's called the Traumatic Brain Injury Program, it's actually not just for individuals who have a traumatic brain injury. We have adopted the definition of acquired brain injury, which includes individuals who've had a non-traumatic brain injury or a traumatic brain injury. So when we're thinking about non-traumatic brain injuries, we're thinking of things like somebody who's had a stroke, a brain injury caused by a brain infection or a brain tumor, or has had an overdose from a substance and had a lack of oxygen to their brain, causing an anoxic brain injury. So those are the non-traumatic brain injury type things that would fall under the umbrella of an acquired brain injury. So for individuals to be eligible for this program, they have to be at least 16 years of age or older. They have to have had a documented moderate or severe acquired brain injury, and have the need for one-on-one support to help them relearn daily functions or to implement strategies to support them with their daily functions so that they can be as independent as possible. If individuals are clinically eligible, they meet that eligibility criteria, they also have to be eligible for Medicaid. So they could be eligible either for traditional Medicaid or for the long-term care Medicaid, which was the application that I showed you. If they're eligible for both, then they can receive care in their own home or in the home of a family member or a friend, or be in a shared living arrangement. So the general services that individuals receive in each one of those settings, in their own home or in a shared living environment, would be case management, the life skills aid support, which is individuals support people who are trained to work with that individual one-on-one based on what their current needs are to help them be independent and function with their daily life skills. Respite is usually included when somebody is set up in a shared living arrangement, and that's where individuals are matched with a home provider through one of our provider agencies. And they create matches through a pretty extensive interview process with both the individual who has the brain injury and also the potential home provider who would be providing the care and support to that individual. There is also a significant focus on employment support for individuals. So if they are expressing one of their goals to regain employment, whether it be paid or via a volunteer position somewhere, we do connect them with vocational rehabilitation services. And the vocational rehabilitation services include, working with the individual to identify what are their current skills, what are their interests as far as work goes, what are they able to do at this point in time, and try to help match them with an employer where they can use their skills. Also, if they're enrolled in the brain injury program, if they gain employment, the life skills aid support person can go on the job with that individual to support them with whatever it might be that they need to be able to do their work. The other thing is assistive device or technology and home modification. So as we talked about having the Assistive Technology Center, if individuals are enrolled in this program, the case managers want to ensure that if individuals need an assistive device or technology or, might need some home modifications, that they are connected with the resources to do so, and there would be funding through this program to help purchase the assistive technology or make some home modifications. The next program is Choices for Care, and individuals enrolled in the Choices for Care program have to be eligible for long-term care Medicaid. They have to be 18 years of age or older with a physical disability, and then they have to meet specific clinical criteria related to their physical functioning. So this program was originally designed to rebalance the system, the long-term care system, and support people or give people choice as to where and how they receive their care. So this program has supported individuals now not just having to go to a nursing facility for care, but being able to receive care in a variety of different ways out in the community. And so the clinical criteria that is looked at is more around physical functioning and people's ability to do their activities of daily living and their personal care, such as, how much support do they need with bathing or showering, what kind of support do they need to move from a sitting to a standing position, are they able to eat on their own, or do they need support with that? So looking at all of those ADLs is what is primarily looked at for the clinical criteria for folks enrolling in this program. And it's for individuals who require a lot of hands-on weight-bearing assistance and support with that physical functioning to meet the criteria. This program does also look at, though, memory and cognition, and so that is also taken into consideration as part of the clinical eligibility. This program does serve around 15 to 20% of individuals enrolled in the program do have a brain injury, so there are certainly some options for supporting individuals with brain injury in the different programs, depending on, if they meet the clinical criteria and what their needs are. So if individuals are enrolled in Choices for Care, they also can receive care in their own home, in the home of a friend or family member. There's also a shared living arrangement, and in this program it's called Adult Family Care. Individuals are able to go to assisted living or licensed residential care facilities if they choose to have their care there, or in a nursing home. So there's a lot of different options and ways that individuals can receive their care in this program. Some of the general services that folks would receive at home are case management. They could have a personal care attendant. Again, the personal care attendant is more focused on supporting the individual with their physical functioning. And those can be through a local home health agency, or individuals could act as their own employer or have somebody act as an employer for them and hire somebody that they know out in the community and train them to meet the physical needs of that individual. There's also respite and companion care. There is funding for assistive devices and home modifications. So a lot of different options. The primary difference between if somebody were eligible for both Choices for Care and the brain injury program, we do sit down and go through all the options with that individual and their support people so they can make the best choice to meet their needs. Unfortunately, right now, the programs are separate in the fact that one focuses and has supports for cognitive and memory, rehab, and the other one is focused more on physical functioning. So, I mean, we all know our minds and our bodies are connected. However, our programs haven't quite caught up to that. They, for whatever reason, were designed somewhat separated. Another program is the Developmental Disability Services Program, and this is not, I'm not as familiar with this program. To apply for services, you would, again, go to a local designated agency. So we talked about the designated agencies for mental health as well. So agencies, the designated agencies are sort of divided in two. One is focused on developmental disability services, and the other half is focused on mental health services, but it would be the same designated agency. And that is where you would go to apply for services if you're an individual who has an intellectual or developmental disabilities. So again, this brings you to the designated agencies. And then I put this comment for eligibility to refer to page 9 because a lot of children who've had a traumatic brain injury are served through this program, as it's one of the criteria written into their rules. And so I think I said refer to page 9. Okay. So there's a lot of different criteria to be eligible for the Developmental Disability Services Program. But you can see here that traumatic brain injury is a condition that's considered as high probability of resulting in intellectual disability. And so it's one of the things that they will consider going through the process for determining if somebody is eligible to receive services through this program. So the Developmental Disability Services also has a lot of different options for how services can be delivered. They are all community-based in the home, but it does include things like case management, having a support person, so on and so forth. So I did include the website here just because I'm not as well-versed with this program as the other two programs I just talked about. Community Rehab and Treatment, otherwise known as CRT. This is through the Department of Mental Health. This is a program that, again, is accessed through the designated agency, and it has a different criteria versus just if someone were to try to access outpatient mental health services. So the criteria include having a qualified mental health diagnosis, which is usually something like schizophrenia, bipolar disorder, something that's pretty significant and persistent. They need to have had a treatment history indicating a need for more intensive services, and this tends to mean, have they had any hospitalizations related to their mental health, or psychiatric illness, and is their psychiatric illness creating a significant functional impairment for them? Is it preventing them from being able to do their daily functions? So I created the link down at the bottom if you want to research that a little bit more. The CRT program does work in conjunction with the brain injury program and Choices for Care program. People can be enrolled in both, and it's a really nice way to meet both the mental health needs as well as physical function or cognitive functioning needs of the individual. It kind of makes it more of a wraparound, more holistic approach to working with an individual with all of those needs. The Vermont Medicaid HighTech Nursing Program this is through the Department of Vermont Health Access, which is our Medicaid department, but the different programs are administered through other departments. So the pediatric HighTech Nursing program is administered through the Vermont Department of Health, and the adult HighTech Nursing program is administered through DAIL, which is the Department of Aging, Disabilities, Aging, and Independent Living. And so we are able to provide high-tech nursing services to individuals who are like ventilator dependent out in the community. So just because somebody might be dependent on a ventilator doesn't mean that they have to be in a nursing facility or live in a hospital. And so this program is designed to support individuals out in the community who have those needs. It also provides, it essentially allows families are trained to meet those high-tech needs of their child or family member, but it also allows them to have a high-tech nurse from one of the home health agencies come in and provide some respite for them, so that way they're not having to do all of the care 24/7. They actually get a break from doing that care. And so you can imagine if you're trying to manage somebody's airway ongoing 24/7, that it's impossible for one person to do. So you need many people who are trained as part of the household, and then having some folks come in with that expertise to provide a break. Also of note, we have some out-of-state neuro rehabilitation facilities that are contracted with Vermont Medicaid, and I just bring this up because here in Vermont we do not have any skilled nursing facilities that have a neuro rehabilitation specialty. We have Fanny Allen and Mount Escutney, but they're acute inpatient rehab facilities, which is different than a regular skilled nursing facility. So a step down from an acute inpatient rehab would be a skilled nursing facility that has a neuro rehab specialty. And none of the nursing facilities in Vermont provide that specialty. So unfortunately, we do have folks that have to go out of state to receive that specialized rehab. It's usually for a short period of time, like 6 months or so, and then we work on transitioning and supporting people coming back to Vermont and being set up with services in the community. So there is a prior approval process that is done before somebody is able to go out of state to one of these facilities. Most of them, as you can see, are in Massachusetts. Neuro Restorative has different locations around the eastern seaboard of this country. However, we don't have all of them enrolled as providers right now. And so I put, just in case anybody needs to access this or knows somebody with a newer brain injury that you think might benefit from this service, you can reach out to Tim Wilcox. I put his contact information on here. So those were all the resources, services, and supports that I could come up with that I thought would be important for all of you to know about. I did want to just put a plug in for the Vermont Brain Injury Advisory Board. This is, we have at least 50% of our membership has to be an individual who's experienced a brain injury or or a family member or caregiver for somebody who's experienced a brain injury. And we are always looking for more members to help support the work and our mission that we're doing. We are a board that is working on creating a state plan for brain injury, which is focused on improving our system of care for individuals with brain injury here in Vermont. Because as I mentioned, there are a lot of gaps in resources and services, and we want to work to improve that and have more offerings for individuals who may not be Medicaid eligible or maybe are not clinically eligible for a Medicaid program but could use some support and services. And currently, those are areas that we really don't have anything available to individuals. we also do, one thing I forgot to mention too is the Veterans Administration. So if you know of a veteran who's had a brain injury, that is a place where they should be referred to initially. And I'm just mentioning that because we're also trying to strengthen our connection with the Veterans Administration as well as we try to work towards improving our system. And so just to give you a brief snapshot of our brain injury state plan, the areas, we had a work group of which we had several individuals who've experienced a brain injury have helped us get to the point that we're at right now with creating our state plan. And the focus areas around supporting early identification and education of acquired brain injury, resource development for individuals with acquired brain injury, and then services for individuals with acquired brain injury. So again, kind of looking across our system and seeing what can we do to improve things for individuals throughout their lifespan, but also looking at the healthcare system too, from point in time or entry when somebody has a brain injury to then being supported out in the community and being supported throughout their lifespan. So if anybody is interested in participating in our advisory board, I would love to hear from you. And this is my contact information. So certainly if you have questions right now or thoughts, want to offer any information, I would love to hear from you. But if you don't have anything right now, you can think of something down the road, you can certainly reach out to me.